My real responsibility to get the University of Michigan to be chair of family medicine. What I do is a fair amount of clinical work, some administrative, some teaching, some research. But my main role as chair is to oversee the operations of the department. I grew up in Chicago, the son of two physicians. So ever since I was a child, I've always thought about medicine. Going through medical school, I loved everything, so family medicine was the obvious choice. I have a profound hearing loss. I always have. So most of my work has been on health services for people with hearing loss. Helen Keller, probably the most famous deafblind person of our time, was asked, which is worse, being blind or being deaf? She said, without a doubt, being deaf is worse than being blind. And when asked why, she said, being blind cuts you up from objects. Being deaf cuts you up from people. Being deaf myself, I understand the communication barrier and the impact it has on people's lives. And I also understand the impact it has on the healthcare. We've done studies, and a few other people have too, to show that people with hearing loss get suboptimal healthcare. People with hearing loss make up about 20% of the population, more accurately 17%. Most of the 80+% of people who hear don't realize the impact a hearing loss has in the 17 to 20% and their healthcare. And so my work is improving the healthcare of that deaf and hard of hearing group, but also letting the hearing group know about that. The other area I'm doing is something called implementation science. Basically, how do we get physicians and healthcare providers to do the right thing? They want to do the right thing, but they're overwhelmed by so many things. How can we use technology? How can we use processes to help them do the right thing? The most important issue facing healthcare in America today, I think, is really a combination of access to healthcare, but also access to quality healthcare. Many people can't afford it, which is why I like the Affordable Care Act, because it allows people to get healthcare, but also the quality of the healthcare. And much of the work we're doing in health policy and health services research focuses around how do we improve the quality of the population and the quality of their health. What makes us unique here at Michigan and IHPI both is the human capital. By that I mean the brain power, the huge diversity of input and knowledge we have. And together we can generate ideas and concepts that we may not have in our individual silos. I became a member here because I'm really passionate about improving the health of communities and my population and my own research with deaf and hard of hearing people. I think IHPI and the connecting afforded here and the support, I can't think of a better way to move that forward. I think healthcare is changing very rapidly. 5 years from now, it's going to look very different than it looks now. I think we're going to be doing a much better job of caring for populations, at least I hope we are, than we are now. I think physicians will be paid differently. They will be incented and paid to think about the health of the population, not just the one person in front of them, although that person is very important too. There can be a lot more collaboration between the different specialties and disciplines working together to move the whole healthcare system forward. The IHPI will play a key role in that. Just look at the last few issues of the New England Journal of Medicine, there are at least 2 or 3 articles in there from IHPI from different people. It's not only one person, it's 2 or 3 people together, and many other publications showing the research that we're doing and the studies we're doing, how we can improve the healthcare system. When you think of that again and again and again, plus the connections we have around the country, I think it can make a significant impact on helping America get better health.